now be handling the description about hernia. It says here that a hernia occurs when an organ or fatty tissue squeezes through a weak spot in a surrounding muscle or connective tissue. The two types of hernia which are most common in toddlers are inguinal and umbilical. And a telltale sign of hernia in children is a bulge or a lump near the groin or thigh, or when the lump is bigger when the child is standing or straining, such as crying, which is most persistent in babies, and coughing, and also disappears when the child is lying down or relaxed. There is also pain and tenderness, and can be accompanied by nausea and vomiting, as well as abdominal bloating.
Inguinal hernia, etiology and risk factors. Factors that place children at higher risk for inguinal hernia include undescended testis, problems with urethra and/or urethral abnormalities, prematurity, a parent or sibling who had hernia as an infant or a family history of hernia, cystic fibrosis, and developmental dysplasia of the hip. Frequency of hernias are 60% of hernias occur on the right side, approximately 5% of all males develop hernia during their lifetime, and premature infants are at increased risk for inguinal hernia with 2% increased risk in females and 7 to 30 increased risk in males. Other factors are sex. Inguinal hernias are much more common in male than in females. The ratio is 4 to 8 males is to 1 female. And other factors are premature infants are at increased risk for inguinal hernia with incidence ranging from 7 to 30%.
Hernia is one of the common problems in toddler years. And here are the clinical manifestations of hernias. First, there is swelling or bulging either side of the pubic bone where groin and thigh meet. Pain is always present either you are moving or not moving. There is a feeling of fullness or no appetite at all. Remember, the lump usually increases in size when you are standing or when you are coughing because there is an abdominal pressure. Bowel movement obstruction may also occur, and you can feel nausea or vomiting, may appear ill with or without fever. However, in some instances, they may feel heartburn, indigestion, difficulty in swallowing, and lastly, frequent regurgitation.
So now I will be discussing about diagnostic laboratory findings of hernia. So usually made through history and physical examinations and can easily be diagnosed with adequate physical examination, including and most notably through inspection and palpation. So careful inspection of inguinal areas can easily diagnose a hernia. An empty abdomen may suggest a diaphragmatic hernia, and imaging is rarely used or rarely needed. But when it is done, it is used to verify a suspected hernia through the use of ultrasonography.
Management of hernia in toddlers. So there are no medications that could treat hernia directly. So the physician may prescribe medications that could only reduce the risk of worsening it, such as stool softener and cough medicine. So there are two types of hernia that could commonly affect the children. The first one is umbilical hernia. Umbilical hernia often closes when the child reaches 1 to 2 years of age. But then if the child reaches 4 years old and then it is not closed, surgery is needed. There are two types of surgery to be performed. The first one is open surgery and the second one is laparoscopic surgery. Next one is inguinal hernia. Inguinal hernia does not heal on its own and can only be repaired through surgery to prevent intestinal strangulation and incarceration. Surgery called herniorrhaphy is recommended to all pediatric patients with this kind of hernia.
Hi guys, this is Cha, your student nurse for today. I am here with my special guest from Pediatric Ward, Trixie! And we are here to discuss the nursing responsibilities in caring for patients with hernia. So let's get started.
A
apply truss in the morning before the patient gets out from bed. Assess the skin daily and apply powder for protection. Watch for and immediately report signs of strangulation. Closely monitor vital signs of the patient. Administer IV fluids and analgesics for pain as ordered. If febrile, give acetaminophen or tepid sponge bath as ordered. Place the patient in Trendelenburg position.